It is quite clear and very clear.
We have seen a transformation.
I will not take it for granted. We have no reason to continue transmitting.
HIV has really...
Whose house is it?
The success of our strategy is
The Zambia Medical Association is the official representative of all medical profession, committed to promoting and maintaining high standards of medical practice through provision of continuous medical education and by influencing national policy and public opinion on matters of health in Zambia.
I'm proud that the leadership that we have always wanted for ZMA is emerging.
It is quite clear and very clear from the science, the evidence, that in fact, option B plus is not only a moral issue, it's an ethical issue.
We need a national program. And if we are going to have a national program, that symptom of B plus must help us improve how we deliver all services.
I feel very privileged to have lived in this time when we could go from something that actually brought shivers down our spine to a point where we can stand here today and say we can eliminate pediatric HIV.
I believe that the time for us to tackle HIV with iron fists is now. The time for us to move and implement and sell mother-to-child transmission is now.
Whose house is it? Whose house is it when another government spends $400 million a year, over $1 million a day to fight your epidemic? Whose house is it?
my problem is not women that are actually reaching the health facility. We are doing something for those women that are reaching the health facility. But remember that there are some women who never go for antenatal clinic. There are some women who don't deliver, not even some women. 50% of women don't deliver in the health facility.
I actually think it does the American spirit well to try and be generous, but it doesn't do us good if you don't help us do it correctly.
We have community development. This is a very powerful tool as well. It empowers communities to sustain themselves.
The success of our strategy is really centered around the community.
And in order for this option B plus to work, available and appropriately trained human resources are cardinal.
We have seen a transformation, and we've moved from research studies in mother-to-child transmission to the implementation of effective programs. And it's exciting today that we're at this point where we're implementing option B+.
So we've done very well in getting women into treatment and getting them started. We haven't done as well at keeping them in treatment.
We also have to be aware that the community are the ultimate end users of the services provided, and we have to ensure that the services and mode of delivery must be appealing and holistic.
I'm convinced that with the current measures that we have put in place, with our infrastructure operational plan, and with our will and zeal as a people, we can implement option B.
Today has been a very important day for mothers and children and families around Zambia. Option B+, as they say, is a new and best option to prevent and eliminate mother-to-child transmission. And I think this morning we saw the leaders of the Ministry of Health and Community Development, Mother-Child Health, express their political commitment. And throughout the day we've seen the Zambia Medical Society show its leadership. And I think that together as a nation, we can eliminate mother-to-child transmission.